Hello everyone and welcome for another MRCS OSCE Clinical History Station. Today we're going to talk about seizure. It will be a discussion between a doctor and a patient, and at the end there will be a discussion between you and the consultant. So we try our best to match the exam. Good morning, I'm Dr. Ali, one of the doctors working here. May I confirm your name and age please? Certainly, doctor. I'm Suzanne and I'm 43 years old. Thank you, Suzanne. I appreciate your cooperation. Today I will be asking you a series of questions related to your recent experience with seizures. Please know that your response will significantly aid in understanding your condition. Is that okay? Yes? Please feel free to ask, doctor. Is this your first episode, Suzanne? No, I had couple before due to my epilepsy. Okay. How many episodes you have per month? From 0 to 3. Sorry to hear that you're experiencing this. Can you share with me the details of what happened during your most recent episode? Specifically, can you describe the sequence of events, where it occurred, and what you were doing at the time? Of course. The episode happened at home a few days ago, doctor. I was watching TV in the living room when suddenly I felt really strange. My arms started shaking uncontrollably and I fell on the ground. Thank you for that information, and I'm really sorry for what happened. Were there any witnesses present during the episode? If so, how did they describe what they observed? My husband was there, doctor, with me. He said that I fell suddenly and began shaking. He was quite concerned and called for help. I see. Did you notice any unusual sensation before the seizure? Any sign that something might happen? Yes, just before it happened, I felt dizzy and lightheaded. It was as if I couldn't catch my breath, probably. That's important to note. During the seizure, did you lose consciousness? If so, for how long? Also, did you sustain any injuries like hitting your head? Yes, I lost consciousness for a short period. It's hard to say exactly how long, but I believe it was around a minute or two. Unfortunately, I did hit my head on the coffee table when I fell. Sorry to hear about that. Did your entire body shake or was limited to specific parts? Additionally, did you experience any unusual movement like your eyes rolling back? My arms and legs were shaking, but I'm unsure about my eyes. My husband might have noted that better than I did. Did you soil yourself? Yes, doctor, I did, unfortunately. Understandable. Following the seizure, how did you feel? Were you confused, tired, or experiencing muscle soreness? When I gained consciousness, I was quite confused and disoriented. My muscles were sore and I felt completely drained of energy. Thank you for sharing those details. Have you experienced similar episodes in the past? If so, could you describe them briefly? Suzanne: Yes, doctor. I had a couple of episodes, as I told you, and they are quite similar to this one. I appreciate you sharing this. Have you identified any trigger that could be linked to these episodes? This could include factors like fever, lack of sleep, or medication changes. Honestly, nothing stands out. It seems to occur out of the blue without any clear triggers. Understood. How frequently have you experienced this seizure? Has it been recurring issues? Doctor, I answered this question already. I told you from 0 to 3 per month, and it's a frequent issue. Thank you for clarifying. Discuss your medical history. Have you ever been diagnosed with neurological condition, had any brain infection, or suffered head injuries in the past? No. Have you noticed any other unusual symptoms such as weakness in your arms or legs, visual disturbance, sensory changes, or weight loss? No, aside from the seizure, I haven't experienced any of those symptoms. I would like to inquire about your general medical background. Have you been diagnosed with any chronic medical condition, undergo surgeries, or are you currently taking any medication? I'm relatively healthy. I've never been at any surgeries. I do take medication though for my blood pressure. What are you taking for your blood pressure, Suzanne? I think lisinopril. Alright. Could you please tell me about your occupation, daily routine, and any significant stress you might be experiencing? I work as a marketing manager for a tech company. My daily routine involves a regular 9 to 5 schedule with occasional late hours during projects. There is some stress in meeting deadlines, but overall it's manageable. You drink alcohol? If so, how frequently and in what quantities? Yes, I do drink socially, usually on weekend with friends or special occasion. I would say I have about 2 to 3 drinks on those occasions. And how about smoking? Have you ever been a smoker or are you currently smoking? No, I've never been a smoker and I don't use any tobacco products. Is there a family history of seizure or neurological disorder that you're aware of? No, as far as I know, there is no history of seizure or neurological issues in my family. Do you have any additional information you would like to provide or any concern, ideas you would like to discuss about your situation? I'm mainly concerned about the possibility of this happening more frequent than usual or having some underlying health issues exacerbating it. Your concerns are completely valid, Suzanne. We will work together to investigate the cause and develop the appropriate plan moving forward. Thank you, Doctor. To ensure comprehensive understanding of your health, I would like to ask you a few more questions related to different areas of your body. Please bear with me as I go through these questions. Have you experienced any palpitation, chest pain, or shortness of breath recently? No, I haven't noticed any palpitation, chest pain, or shortness of breath. Have you had any cough, difficulty breathing, or wheezing? No, I haven't. Are you experiencing any stomach pain, change in bowel habit, or issue with digestion? My digestion has been normal and I haven't experienced any stomach pain or change in bowel habit. Have you noticed any change in your urinary frequency, color, or discomfort while urinating? My urinary habits have been constant and I haven't noticed any change in color or discomfort. Are you experiencing any joint pain, muscle aches, or stiffness? I've been feeling fine in terms of joint and muscles, no aches or stiffness. Have you observed any rashes, itching, or unusual change in your skin? My skin has been normal without any rashes, itching, or unusual changes. Thank you, Suzanne. Rest assured, we are committed to finding answers and providing you with the best care possible. If you have any further questions or concerns, don't hesitate to reach out. Thank you, Doctor. And then you will have a discussion with the consultant for 3 minutes. Make sure you practice presenting each clinical case, because your presentation of the case is the first impression of the consultant about your performance. Present your patient. I took a clinical history from Susanna, 43-year-old epileptic female, present with a recent episode of seizure characterized by sudden arm shaking and loss of consciousness while watching TV at home. The seizure was preceded by a sensation of dizziness and lightheadedness. She has no history of neurological disorder or head injuries. Suzanne's occupation as a marketing manager and social alcohol consumption on weekends are notable aspects of her lifestyle. Her medical history includes well-managed hypertension, and her physical examination revealed no evidence of abnormalities. She denies experiencing arm or leg weakness, visual disturbance, or sensory issues. Suzanne did not vomit during the seizure, maintains a normal appetite, and has not observed any unintentional weight loss. What are your differential diagnosis, doctor? Okay, firstly, this could be, most probably this is another seizure due to her epilepsy, generalized seizure disorder. It could be a syncope. Okay, what else? I need to consider head injuries, brain tumors, alcohol withdrawal seizures, hypoglycemia, and cardiac arrhythmia. How will you investigate your patient? I will perform electroencephalogram to assess brain electrical activity and confirm the presence of abnormal patterns associated with the seizure. I will look for the previous electroencephalograms I will also look for the previous electroencephalograms and compare them. I will perform a couple of blood tests, including complete blood count, electrolytes level, glucose level, and liver kidney function test to rule out metabolic imbalances and underlying medical condition. I may need to perform MRI of the brain. To identify structural abnormalities. I will also perform cardiac monitoring, such as Holter monitoring or event recording, to detect any cardiac arrhythmias. That could be contributing to the seizure. How will you treat your patient? Firstly, I will treat immediate seizure management by 1. Seizure response. Move Suzanne to the safe place. Position her on her side on the recovery position. Observe seizure activity and duration. And then I will prepare to assess post-seizures, ABC. Post-ictal period, I will ensure the ABCs and monitor vital sign. I will administer oxygen if needed. I will consider benzodiazepine for seizure prevention. Ongoing seizure control. Firstly, by anti-epileptic medication. I will initiate appropriate anti-epileptic medication. I will monitor effectiveness and adjust dosage. I will educate Susan on medication regimen. Option for the anti-epileptics includes phenytoin 300 to 600 milligram PO TIAD, nobarbital 60 to 200 milligram BO daily, valproic acid 15 to 60 milligram per kilogram daily divided BID or TID, and carbamazepine 400 to 1200 milligram daily divided TID or QID. Lifestyle modifications. I will emphasize deep hygiene and stress management, and I will advise reducing alcohol consumption. Emergency and follow-up. Emergency action plan includes status epilepticus. I will act promptly for seizure lasting more than 30 minutes, which is the definition of status epilepticus. I will establish IV line, administer oxygen, and monitor. I will consider benzodiazepine, diazepam 10 to 20 milligram IV or lorazepam 4 to 8 milligram IV. I will administer phenytoin 18 to 20 milligram per kilogram IV at 20 milligram per minute rate. I will consider brain tumor. Then, if suspected, I will consider biopsy or resection. And lastly, long-term monitoring, which has two components: schedule regular follow-up and adjust treatment as needed for optimal control. To memorize this treatment, you need to look to the file that's in our Telegram channel. I'm going to provide the link in the description for our Telegram channel. You can press on the link and you will find the file on the channel. You divide it into A, which is immediate seizure management, and then B, ongoing seizure control, and then C, emergency and follow-up, and lastly, long-term monitoring. Each component has a couple of sub-points. So this file will be on our Telegram channel. Good luck with your study, and thank you.